Can I start?
1 minute, I'll put the timer on. 9 minutes, okay?
Okay.
Your time starts now.
Hello, Mr. Salman. My name is Dr. Asba. How can I help you today?
Doctor, actually, I did this test results and
Mm-hmm.
I want to know what's wrong with me.
Okay, Mr. Salman, can I look at the result?
H. pylori positive.
Mm-hmm. Okay. Mr. Salman, may I know why you did this result, this test?
Doctor, actually, I was having this indigestion problem and I went to a doctor.
Mm-hmm.
It was going on for 6 months and then he asked me to go for this test.
Mm-hmm. Okay. Okay, may I know a few more questions, Mr. Salman, for the better understanding?
Sure, doctor.
Hmm. Okay, as you told that you have a problem of 6 months from the indigestion. Okay, and
Yes, doctor.
along with that, you have any tummy pain with it?
Yes, doctor. A lot of discomfort in my here upper tummy and
Mm-hmm.
a burning after meals, and I was getting
Mm-hmm.
nauseous.
Mm-hmm. Okay. And is there any difficulty in swallowing you have?
No, doctor.
Okay. Any change in your weight?
No, doctor.
Okay. Any vomiting you have?
No, doctor.
Okay. Any change in your bowel habits you've noticed these days?
No, doctor.
Okay. Apart from no, in these days you have tummy pain or it is this at that time you have tummy pain
Doctor, still it's going on, and
going
I
on.
was using over-the-counter antacids, but it didn't
Mhm.
relieve me a lot.
Okay. Can you please tell me where is the exact site? Where is the tummy pain is
Epigastric.
the biggest? Okay. Is this pain go anywhere?
No, doctor.
Okay. And what is the severity? If one is 0 is less and 10 is maximum, what is the severity?
Like doctor, 4 to 5 sometimes.
Mhm. Okay. And anything which make it better?
Sometimes this antacids relieves it.
And anything which make it worse?
Yes, doctor. Actually, night meals or
Mm-hmm.
um, whenever I'm eating junk food.
Mm-hmm. Okay. Okay. Mr. Manid, do you have any long-term illness apart from this, like high blood pressure,
No, doctor.
high blood sugar?
No, doctor.
In your family, anyone have the similar condition?
My brother has similar pain.
Mm-hmm. And how is he now? He's taking any medicine for this?
He's also using antacids.
Mm-hmm. Okay. And are you taking any medicine these days apart from the antacid?
No, doctor.
Okay. Any medicine allergy you have?
No, doctor.
Okay. And what you do for your living?
Doctor, I work as an accountant.
Mm-hmm. And how's the environment at workplace? Is there any stress these days?
No, doctor, it's
Mhm.
fine.
Mhm. And what about your diet? As you told, you eat mostly at night time junk. Any specific diet you are taking these days?
Actually, doctor, it's a lot of work all of the day. So I eat breakfast and then I go home by 9 or 10. I
Mm-hmm.
eat back dinner, but I
Mm-hmm.
eat a lot.
Mm-hmm. And Mr. Salman, do you know weight according to your height?
It's 29.
Mm-hmm. And 29 BMI. Okay. And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Are you doing any physical activity these days?
No, doctor.
Okay. Do you have idea what's going on with you?
Doctor, I feel it's kind of bacteria in my tummy.
Mm-hmm. Okay. And what do you expect from me? What is the particular worries you have?
Doctor, now these reports are positive. I can see. Do I have any cancer of my stomach?
I hope not. And what you want from me?
I just want any medication or any treatment
Mm.
plan.
And this condition is impacting your life these days?
Yes, doctor.
Okay, Mr. Salman, let me summarize. As you told that you have a discomfort in your tummy, and you did this test, and you came here to tell you that this positive test may be the you are worried that maybe be cancer, and you want for me to give you some medicine and tell you what is inside the test. Anything else you want
Yes,
to
doctor.
add?
No, doctor.
Okay, may I examine you, Mr. Salman?
Sure, doctor.
Okay, I will check your vitals and pulse, blood pressure, and oxygen saturation, temperature, and will check your general physical examination, hands and eyes and throat, and then I will, in the proper hand sanitation with the presence of chevron, I will look at your, examine your tummy. Okay, please expose up to the tummy, and I will look your tummy, and then I will press your tummy. If you feel any pain, you can stop me. Okay. So I will press superficially palpate and then deep palpate for the visceral galley, and then and check for the also do the PR. Okay, and that's it.
Okay, so deep palpation causes the pain in epigastric region.
Okay, Mr. Salman. After listening you, examining you, and I look at your report, I'm suspecting that I'm telling you that you have a problem which is called the called the peptic ulcer. Okay, due to the H. pylori. Have you
Yes,
ever
doctor.
know about this? As you, what is the H. pylori positive and what is peptic ulcer disease?
No, doctor. No,
Okay, it
doctor.
is a condition in which a bug enter in our stomach and it cause the infection. Okay, so
Okay.
I want to reassure that you are thinking that this is a serious problem. So I want to reassure that this is a quite treatable condition. Okay, so no need to worry. So I want,
Okay, doctor.
shall I discuss a management plan with you?
Sure, doctor.
Okay, so there are two types of medicine treatment. Some is the lifestyle change and some is the medicine. Okay, are you with me?
Okay. Yes,
Okay,
doctor.
so there is a therapy, 7 to 14 days plan of three medicine I will give you. Okay, so it is
Okay.
a meprazole, 40 milligram. You will take it in the empty stomach. Okay, along with that, I will give you the moxicillin 1 gram 2 times in a day, and other is the or other is the clarithromycin 500 milligram 2 times a day. Okay, are you getting my
Okay,
point?
doctor.
And you will
Yes,
take this
doctor.
medicine for 10 to 14 days. Okay. So this medicine may cause your change in your mouth and some tummy upset. Maybe you have this. Okay. So,
Okay, doctor.
okay. And after 14 days, you will come back to me. Okay. So I will reassess you. And along with that, I want to discuss some lifestyle changes with you also. Are you with me? Can I
Yes, doctor.
discuss? Okay, so as you told that you came back late, so please and do the dinner late. So I want to advise you that please take a dinner before 3 to 4 hours before sleep. Okay, so and try to do the daily physical activity as you can do according to your schedule or time, if possible for you. Okay, can you do it?
Yes, doctor.
Okay, and maintain your hydration. Drink a lot of water and avoid spicy foods and junk foods. Take a healthy food. I will, okay,
Okay,
and I
doctor.
will give you the leaflet about this. You will, and you can also search the internet about this also. Okay, are you
Oh,
getting
okay,
my
doctor.
point? Okay, and
Yes.
okay, and if you come back to me within after 2 weeks, so I will recheck your value that condition improve or not. Okay, so we will then I will do the check the special test, you got the urea breath test to evaluate that it's bug removed or not. Okay, so
Okay, doctor.
okay, and in
When
the meanwhile,
will we do this test?
after completion of your treatment. Okay,
Okay, doctor.
after 2 weeks, 2 3 weeks, and when if your symptom become worse during this period and symptom not improve, you can immediately come to me and to the emergency. Okay,
Okay, doctor.
anything
Thanks,
else you
doctor.
want to ask? Thank you.
No, doctor. Okay, your next case is Mr. Iqbal, 40 years old male. Can we discuss his problem with you? Uh,
Miss Mr. Iqbal, 40 years old.
yes, 40 years old.
Okay.
Please take history and the management plan examination is great. Your time
Okay.
starts now.
Hello, Mr. Iqbal. My name is Dr. Asba. How can I help you today?
Doctor, actually, yesterday a dog bit my hand.
Sorry to hear that. Can you please tell me more?
Yes, doctor. Actually, yesterday I was just walking down the aisle and a dog bit my hand, and
Hmm.
I cleaned it, but now I'm so much worried about the infection.
Okay, Vishnu, may I know a few more question for the better understanding?
Yes,
Hello.
doctor.
Okay, can I look your hand? Where is exactly the wound is?
Okay, the wound is on the right hand, two puncture wound with surrounding erythema, no fluctuations, mild swelling,
Mm-hmm.
and full range of movements. Otherwise, everything is intact.
Okay. Mr. Salvan, may I know when the dog bite you, you were going, what you were there when the dog bit you there?
Actually, doctor, I'm a social worker, so we go
Mm-hmm.
home to home, and I was doing my work when I went to a village, and I
Mm-hmm.
got encountered with this dog.
Mm-hmm. Okay. Mr. Salvan, during the yesterday onward, do you have any any difficulty, any dizziness you have during
No,
this?
doctor.
Okay, and any cough? Hello,
No, doctor.
fever you have?
No, no, doctor.
Okay, and any change in your bowel habits? Any
No, doctor.
any headache?
No, doctor.
Okay, and okay, do you have any pain at this site?
Yes, doctor. I have this pain, and sometimes I feel that uh, it's mildly red.
Mm-hmm. Okay, and is there any tingling sensation around the wound?
No, doctor.
Okay, do you feel any change in your behavior?
No, doctor.
Okay, and okay, do you feel any change to see the water? To feel any difficulty to see the water?
No, doctor.
Okay, what do you, apart from the, do you have any long-term illness you have?
Doctor, I have this diabetes, type 2
Mm-hmm.
diabetes.
And for how long you have this?
It's just 2 years now.
And what you are taking for this?
Metformin.
And is this you checked regularly? It is controlled.
Yes, doctor, it's
And
completely controlled.
you are
6.5.
mhm. Okay. Apart from
Mm,
this, any other medicine any other illness you have?
no, doctor.
Okay. And in your family, anyone have the
Mm,
similar problem, and any other have this same type of problem, like high blood sugar and anything? No.
Yes, doctor, actually, my dad had similar problem.
Mhm. Okay. And how is he now?
He is fine.
And I want to ask when you hit the dog, what you do first? Have you washed the wound or not at the time?
Yes, doctor, I washed it under the tap water, cleaned it
Mm-hmm.
completely.
Okay, and okay, and did you take any medicine for this from
No,
yesterday onward?
doctor.
Okay, okay. Do you have any other medicine apart from metformin? Are you taking?
No, doctor.
Okay, any medicine allergy you have?
No, doctor.
Okay, what do you do for your living?
Doctor, I'm social worker.
Oh, yes, you already told me. And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What about your diet these days?
I take good and healthy diet.
And do you know weight according to your height?
23.
Okay, do you know what's going on with you?
Doctor,
Any
I
idea?
just feel it's yeah, it's a dog bite, so I feel like I might get blood poisoning.
Okay, and what you want? What particular worries you have?
I'm very anxious about this disease called rabies.
Okay, and what you want from me?
Doctor, I want some antibiotic.
And this condition is impacting your life these days.
Yes,
This
doctor,
is
a
it.
lot. I'm worried since yesterday.
Okay, Mr. Salman, let me summarize. As you told that you bit the dog yesterday, and you were worried that there is some rabies infection, and you came here to give you the some medicine and antibiotic. Anything else you want to add?
No,
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 no.
doctor.
Okay, may I examine you?
Sure, doctor.
I will check your vitals and do general physical examination and look at the your wound area and all. For already you told me this, so that's it. Okay, so
Okay.
Mr. Salman, after listening you uh, uh, and examine you, so second, I want to give you that you I want to give you some medicine and some vaccine at that time. Okay, I
Okay,
want to
doctor.
discuss some management plan right now. Okay, so are
Okay.
you with me?
Yes,
Okay,
doctor.
okay. As you told me that you are worried about rabies, so yes, your worries are right. So it may cause this dog may cause some problems for you. Okay, so at that time, and you are, as you told, you are diabetic. So in this case, wound care and wound management is more important. Okay, so
Okay,
are you
doctor.
getting my point? So okay, so at that time, I give you the give you the vaccine. Okay, five doses of
Okay.
vaccine, and at that time, no, at that time, and along with that, I will give you the immunoglobulins also. Okay, and also I will give you the comoxiclav antibiotic also. Okay, so
Okay,
as
doctor.
you are diabetic, so it will be more important to take care of your wound. Okay, so
Okay.
okay,
Okay.
and along with that, I'll give you the paracetamol. Okay, so for your pain and this discomfort. Okay, so this
Okay.
vaccine will be the, as you know, you I will give you the cards. Okay, and we will give you the infection control department. Okay, so it will give you the right now one dose, then second dose will be at the third day. Okay, then 7 days you will
Hmm.
take this. Okay, and then after that
Okay.
14, and then 28 days you will
Okay.
take all these 5 doses. Okay, and along with the antibiotics I'm giving you and the immunoglobulins. Okay, so
Okay, doctor.
along with that I am giving you that you please take care of your wound. Okay, avoid dust, anything from this wound. Avoid it from the any dusty material, and try to wash it with a clean water before. Okay, and
Okay.
along with that, take a healthy diet as you already taking. Continue it. Okay, and try to do some physical activity. Okay, and we give you
Okay,
the
doctor.
leaflet about the rabies. You will completely read it, so it may further what it caused and further complication and about all the details of rabies. You can take it, read it about it. Okay,
Okay,
and
doctor.
in this condition, if you feel any different change in any particular complaints like confusion, any difficulty in water, to see the water, you feel any fear, anything in your behavioral change, you can immediately come to me or the emergency. Okay.
Okay, doctor.
Anything else you
Okay.
want to ask?
No, doctor.
Thank you.
Okay, so still you have 1 minute remaining. We'll move to next case.
Okay. Third case now.
Yes, if there are two people, I was thinking two cases. Dr. Khalud is there or not?
Yes, I'm here, doctor.
Okay, Dr. Zulfikar is there. And one more, Dr. Khalud also asked me to. Okay, so we have two participants, so we'll go three cases.
Oh,
Okay, Dr. Asba, your
okay.
third case is
Yes.
um Mrs. Amna came
Mm-hmm.
to discuss a problem with her child,
Mm-hmm.
7 years old child.
Mm-hmm.
And please proceed with history and management plan. Examination is not required. 1 minute, I'll
Okay.
put the time.
Miss Amna.
Mrs. Amna.
Mrs. Amna. Okay.
Okay, the time starts now.
Hello, Mrs. Amna. My name is Dr. Asba. How can I help you today?
Doctor, actually, I'm worried about my daughter.
Mhm. Okay. May I know what is the name of your daughter?
Doctor, her name is Aisha.
And may I know where is Aisha right now?
She went to school, but I'm here because I was worried.
Okay. Can you please tell me about Aisha? What you
Yes,
want?
doctor, actually, she has been complaining of tummy pain, and
Mm-hmm.
she's not acting like she used to be, and I'm now getting worried.
I'm sorry to hear that. Being a mother, it's very distressing for you. I can understand. Okay, please tell me more about this.
Doctor, actually, starting, she said that she is having tummy pain, and
Mm-hmm.
every time it's going on for 2 to 3 months, by the way.
Mm-hmm.
And she doesn't talk to me properly, like she's thinking somewhere else, she's getting
Mm-hmm.
anxious, and she doesn't
Mm-hmm.
want to go to school some days.
Mm-hmm. Okay. Okay. Mrs. Aisha, may I know few more for better understanding of the Aisha condition?
Sure, doctor.
Okay. Can you please tell me for exact how long you feel this problem with Aisha?
It's been 2 to 3 months.
2 3 months. And Aisha told you that where exactly the tummy pain is? Is it any
She
specific
tells
site?
me it's all over.
All over.
No, she tells me it's all over.
Okay. And is there any change in in her bowel habits these days? You notice?
No, doctor.
Okay. Any
No.
urinary complaint she has?
Um, these days she started bedwetting again.
Okay. And before she is fully trained to the toilet.
Yes, doctor.
Okay. And this betty wetting only at night or daytime she also has this problem?
Only at night.
At night. Okay. And if I will look back, may I know what the birth of Aisha was? It was everything was normal at the time of birth?
Yes, doctor, everything was fine.
Normal. And his vaccination is complete?
Yes, doctor.
Okay. And what about his school beach behavior these days? As you told that he's not willing to go to school sometimes. Is there any school feedback you notice these days?
Doctor, her teachers are saying that she's distracted and sad, and recent performances are dropping.
Okay. And what about the diet of Aisha's these days? What about his nutrition?
His nutrition is fine, doctor.
Hmm. Okay.
I'm
May I?
trying to give him,
Please go ahead.
yeah, I'm trying to give him good nutrition, but I feel like he's not eating
Mm-hmm.
enough.
Mm-hmm. Okay. And may I know, before a few months back when the problems are, is there any specific event happened before this problem start? Any new?
No, doctor.
Mm-hmm. Okay. And with whom she go to the school? Drop him or any his father drop him?
Doctor, I drop him.
You drop him. And okay. And okay. And apart from this, any other long-term illness Aisha has?
No, doctor.
Okay. And how many siblings she has?
Only one. She's my one child.
Okay. And is there any medicine you are using? She's using these days?
No, doctor.
Okay. Any particular allergy to any medicine allergy she
No,
has?
doctor.
Food allergy she has?
No, doctor.
Okay. And what you do for your living?
I work as a teacher in another school.
Okay. And what's your last menstrual period?
It's 2 weeks ago.
And are you using any many birth control pills these days?
Yes, doctor.
And where is Aisha's father? Where is Aisha's father now?
Doctor, he stays sometime at home. He's mostly out of the town. He comes on
Hmm.
weekends.
And he knows the Aisha's problem, facing this problem these days. He know about it.
Yes, doctor. He was like, maybe it's any bug in her tummy, but I don't feel like this, doctor.
Mm-hmm. And is there any family time, any specific time where you all sit together and eat together? Any?
Yes, doctor. We all try to stay together.
Okay. Is there anyone else in your home along with that who live at home with you people? You and
Doctor,
Aisha?
actually,
Mm-hmm.
yes, actually, our like this uncle of his of her,
Mm-hmm. Mm-hmm.
he's visiting these days, and I'm
Mm-hmm.
feeling that he's fearful of being left with him. in
Mm-hmm.
particular.
Mm-hmm. That's not okay. 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 And anyone else in the family smoke?
No, doctor.
Okay. But do you have idea what's going on with Aisha?
No, doctor. Even though I asked her, she doesn't tell me.
Okay. Any particular worries you have?
Yes, doctor. I'm very much afraid, like what's going with her. Any serious
Mm-hmm.
thing?
I can understand how distressing it for you. And what do you want from me?
I just want to know if it's a normal child
Mm-hmm.
behavior because, doctor,
Mm-hmm.
I don't want to think
Mm-hmm.
that there is something serious.
Mm-hmm. And this condition is impacting your life and Aisha's both life these days.
Yes, doctor.
Okay, okay, Miss Aisha, Miss Samina, as you told me that you have your daughter Aisha has some tummy pain from a few months, and along with that, she has changed in his behavior and her behavior. And you came here, you are worried that say that there is something only problem in his tummy, and you want me to give you some medicine and tell you what's it is this. Anything else you want to ask?
No, doctor, that's all.
Okay, Ms. Amina, before proceeding you, I want to tell you that please I want the Aisha right now. Okay, so and
Uh,
if it's possible for you, you come back and bring him here. No,
doctor, why is there something serious?
actually, I'm at that time I'm not saying anything, but I'm suspecting that there is something suspicious. Okay, so
Okay,
also I am sending someone with you from my side. So you go home and pick him from school and come back to me today. Okay. So
okay,
in the meanwhile, I will examine him thoroughly, and I will also involve the some local child protection team. Okay. So I am
okay,
suspecting
doctor.
that there is something suspicious problem, and I also investigate it further. And okay, are you getting my point?
Okay,
So
okay, doctor.
I also involve the inspection and investigation of his uncle also. If okay,
Okay, doctor.
yeah. So it is a please. I want to tell you that this is a some serious matter. Okay, so please,
Okay,
please take it serious. Bring him right now. Okay, well, I will send someone with you to bring her right now. We will examine her and then we will investigate it. Okay.
okay, doctor.
Okay. So I can understand it is very disturbing for you, and I'm showing that this is not. I'm not accusing you that there is a some your side problem. Okay. So I am suspecting
Okay,
that so it will be investigated as early as possible. Okay. S- As you
okay,
told
doctor.
that this problem is right now, and this is she is changing his behavior in these days.
Yes,
So this
doctor.
is not normal. There is something going on. So need to
Yes,
investigate.
doctor.
Okay.
Time's up.
Okay. Okay.
Okay,
Thank you. Thank you.
okay. Thank you, Dr. Asba. Okay, let's go from case to case. Just 1 minute. Okay, so your first case was of dyspepsia with a spiral eye positive. Here the patient was um, with his reports, right? Hello?
Yes, doctor.
Okay, okay. So, firstly, you asked everything. History was good, examination was fine, and red flags, differentials. Um, we can ask about a bit of breathless, okay?
Okay. Okay. Okay.
Just to rule out since he has is having the epigastric pain, even though it's H. pylori report, but still have to
Mm-hmm.
a little bit
More of
differentials.
okay. Okay.
Yeah. And otherwise, everything is fine in this case. I don't need to add a lot.
Mm-hmm.
Only that the management plan you started, it was 7 to 14 days with the
Yes, 14.
antibiotics.
Yes, 10 to 14 days, I told. Yes, 10 to 14
Yeah,
days.
you gave the triple therapy.
Yes, triple therapy again.
Yeah. Here, one important thing, whenever we are giving these kind of therapies or proper 7 to 14 days course, we have to uh,
Ask, do you
like
have taken any
emphasize,
uh,
uh, yeah, and also emphasize the patient to continue and finish this course. We
finish
cannot,
this?
you cannot stop this course in the middle.
Mm-hmm.
And
Okay.
to post treatment will be done
Mm-hmm.
after 2 weeks of stopping PPIs and 4 weeks um, of stopping the antibiotics, if I'm not wrong.
So then we will
Okay,
do
there
this
is,
test which I asked, the urea breath. Then we will
yeah,
do this.
uh,
Okay. Okay.
okay.
Okay.
Okay, so you have to stop PPIs 2 weeks before the test of cure, and you can
Okay.
repeat stool antigen and breath test 4 weeks after the completion of complete course.
Okay. Okay.
Okay.
Okay.
So
Okay.
lifestyle you told, and otherwise it was all good.
Okay.
Safety netting was done. Next was the dog bite. You
Yes.
asked red flags, tingling, behavior changes, and you were using the word hit. You got hit to the dog. Instead,
Yes,
we will say
bite
you
the
got in,
bite.
yeah,
Okay. Yes.
encountered. Yeah.
Okay. Okay.
So here we need to ask two or three few things like was a dog pet or was a stray
Okay.
dog?
Okay.
Okay, you can
Okay.
ask it, and did the dog has any owner, or do you know if he doesn't have any owner, dog doesn't have any owner, so it means it's stray.
Stray dog.
Secondly,
Okay.
his vaccination status. The social worker's vaccination status wasn't asked. So he went
Okay.
through all the vaccines, just the booster wasn't sure.
Okay. Okay.
Okay, and
Okay.
it's
Okay.
not, it's grade two since you can start him on the
Because
you have to do the first wound care, irrigate and clean thoroughly. He already did it.
it did. Yes.
Okay.
So
Yeah.
no
And
need to give anti.
antibiotics.
I will just because he's a diabetic, so I think that more extra care or protection. So that's why I want.
Yes. Yes.
So no
Any
need to
bite
give
either.
antibiotic.
No, no, no. Here we will give prophylactic antibiotics in
Okay.
every bite.
Okay. Okay.
Okay. Especially with any injury with diabetic patient, we have to start
Give.
prophylactic antibiotics.
Okay. Okay.
Okay. And for tetanus, yeah, give booster if the
Give
course is
booster.
incomplete. And you can
Okay.
also give immunoglobulin if it's a high risk for unvaccinated patient. But here
Okay.
booster can do work, but here also immunocompromised. So in this case, both will be given
Both will
booster
be
plus
given.
the immunoglobulin. Okay,
Okay.
any
Oh.
immunocompromised like hepatitis, viral infections, HIV, or these
Oh.
diabetic patients.
Okay. Okay. I missed the vaccination status and stray dog. I
Yes,
think about it, but it then history. When I remember the history time gone. So I think no need
yeah.
how to go back to ask the stray dog or the pet. So that's
Yeah, but it's okay. It's not very important. First, one question for the dog, but
mm-hmm.
very important vaccination question should be asked
Vaccination
for
schedule.
the, yeah,
Yes. Yes.
because that
Okay.
will differ the management plan. And
Management plan.
along with tetanus, we will give rabies, and you did the right post-exposure prophylaxis.
Mm-hmm. Okay. Okay.
Okay.
Oh.
And safety netting was done, especially the red flags you asked about tingling or this behavior changes or any fever rigors, then he can come as soon as possible.
Mhm. Okay.
Third case was child abuse. Did you use word child abuse?
No, I didn't use child abuse. I just say there is something suspicious with her. So we need to investigate it as early as possible. Not say the word child abuse. I forgot to say like
Uh,
this.
yeah. Sometimes if you tell your suspicious could be going on, and if
Mm-hmm.
the SP insists you, because sometimes they
Mm,
want to hear this word, so you can say I am suspecting there could be a child abuse
child
as you
abuse.
are also concerned that the
Oh.
uncle she's not going to the uncle also because
Mm-hmm.
mother was also already concerning this cause,
Mm-hmm.
considering this
Okay.
cause. Okay,
Okay.
otherwise, what was important? Yeah, double barrel. As in this case, there was one double barrel question, otherwise wasn't fine.
Okay.
Two
Okay.
important question, any bruises on the body of the child?
Mm-hmm.
Second,
Okay.
any bleeding from any part of
Any part of
of
the
her
body.
body?
Okay.
These two important.
Okay.
And
Okay.
also she was having nocturnal enuresis. Again, you can just add one line after seeing him. I'm also considering after seeing him, I will change his, I will give management for her
Management for
bedwetting.
bedwetting also.
Yeah,
Okay. Okay.
yeah, we cannot forget it.
Okay.
This could be linked with her moods. Okay, so
Okay.
same day, right now, you have to see the patient child.
Okay. Okay.
And otherwise, you did right in this case. But if SP asks you twice, then you have to say this word child abuse.
Okay. Okay. If SP asks, then we will say child abuse. Otherwise, not. You are saying like this? Yeah, we will
Yeah,
directly say that this is a child abuse. Or first we say that this is the suspicious. Then if you ask what suspicious mean, then we will say this is a child abuse. I'm suspecting that there is a
yes,
child abuse mostly. Okay.
yes. In the recent exam, it happened like somebody said that it looks suspicious to me. Then the SP like reinforced them. Like, what do you think it could be, doctor?
Okay.
Then he like said it could be child abuse.
So
But
we
for
can directly
surety, I
say
need to.
directly say without saying suspicious that it could be a child abuse.
It
Yeah,
depends on the SP.
SP.
It,
Okay.
both are fine.
Both are
Okay,
fine.
still
Okay.
have to tell the diagnosis. We are not leaving the room without diagnosis. So you
Mhm.
still have to tell. But you
Okay.
are not sure. You said you will say I need to still look it up by
Okay.
after seeing the patient and I'm involving this, and everything was fine otherwise. Okay.
Okay. Okay. Okay. Okay.
And you can also involve psychologist here, child
Child
psychologist.
psychologist and investigating team like any police
Yes.
department and
In,
child protection
better
department,
to say yeah, better to say child protection department
protection
or
department,
investigating team.
investigating team. Yes. Okay.
Yes.
Oh,
Okay, doctor. So this was for your cases. Nicely done. It's kind of odd cases, like doesn't
thank.
come a lot, but very tricky.
Okay. Thank you, doctor.
Mm. Thank you. Thank you. So, Dr. Zulfikar, are you available?
Yes, yes, doctor.
Okay. So your patient is 1 minute. Your patient is Miss Sarah, 19 years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is gray. And your time starts 1 minute. The time starts now.
Good morning, Ms. Sarah. I'm Dr. Ali. How may I help you today?
Doctor, actually, I'm concerned about myself.
Okay. Can you please tell me more about your problem?
Yes, doctor, actually, everyone keeps saying that I'm very thin, and but I just feel fat all the time. And I'm not eating a lot.
Okay. I appreciate your feelings. Um, Let me assure you that today my discussion with you is extremely confidential. So feel free to ask me any question you want.
Okay, doctor.
So could you please tell me since how long you have been suffering from this problem?
Doctor, since like 8 months now.
8 months.
Yes.
Before 8 months, how were you managing? Was it going well?
Yes, doctor, I was completely fine. Then I felt that I'm overweight and I was just not eating. I'm not eating even just one time a day that are salads.
Okay. No protein or any carbs.
No, doctor.
Did you
Very
measure
low
your
calories.
Okay? Did you measure your weight 8 months before?
I almost lost 9 kgs.
Okay. What is your BMI right now, please?
16.
16. Okay. So, Miss Sarah, what is your problem right now? How are you feeling? Any weakness, fatigue?
Doctor, actually, I'm afraid to gain weight.
Okay. Or you said that you are taking only the vegetables and fruits, no carbs, or yeah. So are you are you feeling any weakness in your body?
Yes, doctor. Sometimes I feel this disease spells.
Mm-hmm. Have you lost your consciousness anytime?
No, doctor.
Any headache?
No, doctor.
Any blurring of vision?
No, doctor.
Any low grade or high grade fever?
No, no, doctor.
Any lumps and bumps anywhere in the body?
No, doctor.
Any rash over the body?
No, doctor.
Okay. Any joint pain?
No, doctor.
Have you ever felt any chest pain or breathing difficulty with it?
No, doctor, but I just feel fatigued a lot.
Fatigued a lot. Okay. Any change in your periods? I'm asking you a little bit private questions, please. Can you allow me?
Sure, doctor.
What about your periods?
Doctor, actually, it stopped 6 months ago.
Okay. And was it regular before?
Yes, doctor.
Okay. And are you using any kind of medications?
No, doctor.
Have you ever suffered any long-term medical illness?
No, doctor.
Any member of your family having similar illness like you?
No, doctor. I don't have
Are
any
you
illness, doctor.
okay? And any medication allergies you have?
No, doctor.
Okay. So are you working or studying?
I'm studying.
Where actually?
This is my first year to university.
Okay. So are you attending your classes regularly?
Yes, doctor. Sometimes I have to skip because I feel so weak, so I'm not going.
Okay. And are you feeling down and depressed?
Sometimes the slow mood, and I have anxiety, doctor, because I just don't want to get fat.
Yeah, I understand and I appreciate your feelings, Ms. Sarah. And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. Did you notice any change in your bowel habit?
No, doctor.
Any water work change?
I feel mostly dehydrated.
Mostly dehydrated. So how much water you are drinking?
3 to 4 glasses a day.
Mm, okay. Are you always wearing loose clothes?
No, doctor.
Okay. So anyone bullied you or say bad words to you before regarding your body image?
Doctor, actually, I am very fat and everybody is calling me thin and they are
Mm-hmm.
saying that it's something wrong with my brain.
Mm-hmm.
There's nothing wrong with my brain, right?
Okay, yeah, I do suppose that you are okay, normal. And any down, depressed feeling you have?
No, doctor.
Have you lost interest in your usual activities?
No, doctor.
Okay. So, Miss Sarah, what's going on in your mind? What do you think?
Doctor, actually, I'm here for some medication. I want to lose more weight. I still feel that I'm really fat.
Mm-hmm. Is it also more concerning for you?
Yes, doctor.
And what do you expect from us today?
Doctor, I just want any medication or something, any intravenous injections.
Mm-hmm. Okay. I appreciate your feelings. I will try my best to help you, Miss Sarah. So, in summary, you are university students, and you think yourself to be fat. You are having a BMI of 16, and you still want to lose weight because you think that you need to lose weight. That's why you came here for taking some treatment and advice. Is that okay?
Yes, doctor.
So, Miss Sarah, after talking to you and examining and the things taking into consideration, I think you are most likely having a condition called anorexia nervosa. Are you familiar with this?
No, doctor.
Actually, it's a condition. In broad term, it is called a eating disorder. When a person having a feeling that he or she is having, mostly it is affecting ladies, unfortunately, but here the person is feeling herself or himself as fatty despite losing a significant amount of weight. Okay.
Okay, doctor.
And they usually avoid calorie rich foods and taking some salads or non-calorie foods mostly. Uh, to be honest, your condition it needs to be very taken care of very cautiously. Are you getting me?
Okay, doctor.
And it would be better if you can be admitted in our under a special care of a mood doctor who would give you counseling, and we will tell you about the harm of this excess weight loss. Although you are not thinking like that, but I do believe that it would be better for you if you can cooperate with us. How about it?
Okay, okay, doctor.
So,
So, what should I do?
yeah, I will be offering you an admission into our short stay unit for doing investigations like full blood count, ESR, CRP, and liver function test, kidney function test, serum electrolyte. Okay. Because
Okay.
you may have multiple problems, especially the electrolyte, the salt contents of the body. So it should be gradually and very stepwise fashion. We have to correct it. Okay, and you need to spend few
Okay.
days with us with our treatment. We are assuring you of your full confidentiality, and we will be taking care of all your needs. And the team is very much competent to take care of your problems and as well as giving you support. Okay, if you need any sort of support, please count on us. We will give you leaflets and brochure regarding your condition, and to
Okay.
read about it, and in any query you can reach to us through hospital contact number. How about it?
Okay, doctor. Time's up.
And okay, in any case your condition deteriorates, you can come to us. Thank you.
Okay. Thank you, doctor.
Is it 9 minutes,
You're
doctor?
next.
Yeah.
Yes, 9 minutes.
Okay,
Nine
okay.
minutes.
Sure, thank you, doctor.
But
Yes.
it was above 9 minutes, so I stopped.
Yeah. Yes.
Okay, so next case is Mrs. Khan came to discuss her child's problem with you. Please proceed with history and management plan. Examination is not required. And
So
your time starts now.
good morning, I'm Dr. Ali. Is it Mrs. Khan?
Yes, doctor.
Nice to meet you. I'm here to talk to you about your son. May I know his name and age?
Doctor, his name is Bilal and he's 3 years old.
Okay, so Ms. Khan, could you please tell me how may I help you?
Yes, doctor, actually, I'm worried about his condition. He has been pulling his ear and he's
Mm.
crying with pain and since last night.
Okay, could you please tell me more about it? That from how many days he is having this pulling of ear means ear.
Yes, yes, doctor. Since three
What?
days, he he got a recent cold 3 days ago. And then
Okay.
doctor, he started pulling his ear and also he's having fever and he's
Mm-hmm.
being irritable and not sleeping enough.
Okay, I'm so sorry to hear about it. Is Master Bilal is here?
No, doctor, he's at home.
Who is taking care of him?
My mother, she's taking care of him.
Okay, actually, Bilal has to be here for full for examination and checkup. Please, next time, take him to us with you. Okay.
Okay, doctor.
So, since 3 days he is having some fever. Does he have any throat pain?
I don't know, doctor. He's just not drinking, he's not eating enough.
Okay. And has he vomited?
No, doctor.
Any saliva coming from his mouth continuously?
No, doctor.
Does he have any discharge from the ear, especially which ear it is more, right or left?
Right.
Okay. Any heaviness? Is he complaining of any heaviness?
No, doctor.
Okay. Any congestion in his eyes?
No, doctor.
Any breathing difficulty?
No, doctor.
Okay. Any what to say? Uh, any rash over the body
No, doctor.
or any joint pain?
No, doctor.
Any increase or decrease bowel movements?
No, doctor.
Any
It's
burning?
pure
Is
wet nappies.
sorry, wet napping. Okay.
Yes, pure wet nappies.
Okay. Bed nappies.
Yes.
Okay. And does he have any allergies to any medicine?
No, doctor.
Okay. How was he born actually?
Normal.
Any complication he suffered?
No, doctor.
Okay. Is his vaccination shots till now are complete?
Yes, doctor.
Is he taking nutritional diets?
Yes, doctor.
Is he doing all the activities according to age normally?
Yes, doctor.
What about his other siblings? Is he a lone child or another siblings you have?
No, doctor. This is my only child.
Only child. And is there any sick person contact recently?
No, doctor.
Okay. Last time when he feed well, actually, 3 days ago or before he was not feeding well?
3 days ago.
What apart from any what food is he taking mostly?
Doctor, mostly he's taking fruits and sometimes he's taking fries.
Okay. Does he complain of any? Does he taking the food normally?
Yes, doctor, but not a lot. Like he used to take a lot of food, but now he's uh,
Mm.
saying that
Okay.
is tugging his ear mostly.
Rubbing his ear mostly. Okay. Did you notice the any red discoloration of his ears?
No, doctor.
Okay. Uh, did he suffer from any childhood disease in the past or any hospitalization?
No, doctor.
Okay. Any similar illness in your family?
No, doctor.
Okay. So how are you managing his condition for the last 3 days?
Doctor, just I'm giving paracetamol, sometimes brufen, but it's not relieving a lot of.
Is there any nose jam, nose block there?
No, no, doctor.
Okay. Did he lose his consciousness anytime, or
No, doctor.
any abnormal shaky movements anytime?
No, doctor.
Has he ever suffered from any abnormal shaking since his childhood?
No, doctor.
Okay. So, Miss Khan, what's going on in your mind?
Doctor, I feel it's an ear infection.
Okay. And what concerns you most?
Doctor, I want to know what should I give him? It might go to his
Okay.
brain maybe.
Okay. And what is your expectation?
And doctor, any medication?
Yes.
Antibiotics?
Yes, Mr. Hamis Khan, we are here to help you and your child. Let me summarize that your son, Mr. Bilal, is 3 years old and he is having some fever, throat, pulling his ear, right ear, especially for 3 days. He is not eating well. you are suspecting that it could be an ear infection. It might go to brain, and you want some antibiotic. Is that okay?
Yes, doctor.
So, Ms. Khan, but he has no he discharged from his ear. Is that okay, no?
Yes, doctor, no discharge.
No discharge. So, Ms. Khan, uh, let me, after talking to you and the data I got, your son might have some issues in the ear, maybe some infection in the ear called otitis media. But we need to be absolutely sure first. We need to examine Master Bilal and to do some to check out properly to get to the condition absolutely sorted out. So I would like to examine him, and at the same time, I'm giving you some medications like Panadol and Brufen to control the pain. And as soon as possible, he should be here for the checkup. And I will also arranging a follow-up with the consultation follow-up with the ENT specialist for your children. And at the same time, I would giving you some leaflet brochure for further reading. Okay. And in the meantime, if Master Bilal's condition is not improving, or rather he is getting high fever and discharge from the ear, so you should not waste time and come to us immediately for the management. How about it?
Okay, doctor.
And I appreciate your feelings that it could be an ear infection, but we need to detect it first and to be sure, absolutely sure about it. And we need to do the needful very urgently. Okay.
Okay, doctor.
Okay. Anything you want to add?
No, doctor.
Okay, so I'm also leaving you the hospital contact number to contact us in any moment of emergency. And I will be waiting for Mr. Bilal for the next session as soon as possible. Have a good day. Bye-bye.
Okay, doctor. Thank you, doctor. Okay, completed in 9 minutes. So your next case is Mr. James, 60 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Okay,
And your examination is gray. Okay,
okay,
your time
okay.
starts now.
Good morning, Mr. James. I'm Dr. Ali. How may I help you?
Doctor, my body is aching all over.
Oh, I'm really sorry to hear about it. Could you please tell me more about your problem?
Actually, doctor, at night my thighs are aching. Sometimes my back muscles are aching. It's been going on for now like 3 weeks.
3 weeks. Is it the first time that it is happening?
Yes, doctor.
How severe the pain is on a scale of 0 to 10?
Doctor stays like 4 to 5, and when I'm doing something, it gets worse.
Okay, and if you take rest, it gets settled and disappears.
Yes, doctor.
Are you having any joint pain also?
No, doctor.
Any rash?
No, doctor.
Does you any morning stiffness?
No, doctor.
Okay. Are you having any problem in combing hair or chewing things?
No, doctor, but it's very difficult for me to climb stairs.
Okay, and also you have to take help from sitting position to standing.
No, doctor.
Okay. Are you having any pain in your shoulder and hips?
Mm, only this thigh muscles and sometimes doctor calf also.
Calf also. Okay. Um, are you getting tired and fatigued every now and then?
Yes, doctor.
Did you lose any weight?
No, doctor.
Okay. Any fever with it?
No, doctor.
Okay. Any cough, shortness of breath?
No, doctor.
Any chest discomfort?
No, doctor.
Okay. Any tummy pain?
No, doctor.
Any lumps and bumps?
No, doctor.
What is your BMI?
31.
31. Okay. Did you notice any headache,
No, doctor.
any vision problem,
No, doctor.
or any scalp tenderness over your forehead, sides of the forehead, cheek?
No, doctor.
Okay. Any waterwork problem,
No, doctor.
any bowel disturbance?
No, doctor.
Are you using any medication for long-term illness like high blood sugar, high blood pressure?
Yes, doctor. Actually, I have this high blood pressure and high lipids, so I'm taking medications for it.
Okay. And can you please name the medications?
Ramipril 5 milligram, and I just started this atorvastatin.
Atorvastatin. Which dose maybe?
Sorry, simvastatin. It's a 40 milligram.
40 milligram. Okay. It has just started.
Yes, doctor.
Okay. Maybe it's 4 weeks or 6 weeks like this or more.
8 weeks ago.
8 weeks ago. Okay. Have you had any allergies to this medication or any other medication?
No, doctor.
Have you ever suffered any heart attack or stroke?
No, doctor.
Okay. Any other family members suffered similar illness like you?
No, doctor.
Could you please tell me what do you do for your living?
Doctor, I'm an accountant.
You are still working?
Yes, this is my last year of working.
Okay. So, Mr. James, a few personal questions may I ask you, please?
Sure, doctor.
Do you smoke?
Yes, doctor.
How many cigarettes for how long you are smoking?
10 cigarettes since 20 years now.
Okay. So, Mr. James, have you ever thought of quitting smoking?
No, doctor.
And if you want to quit smoking, that would be better for you, and I would help you in this regard if you want.
Okay, doctor.
What about you drinking?
On weekends.
Okay. Any down, depressed feeling recently?
No, doctor.
Any stresses at home and office also?
No, doctor.
Is it affecting your day-to-day life?
No, doctor.
So what do you think? What's going on?
It's just, doctor, every day I'm feeling tired. I don't
Hmm.
know if it's old age or is it something bad happening with me.
Oh, I appreciate your concern, feeling also. So what concerns you most?
Doctor, I'm concerned about any bone problem.
I will try to sort it out as soon as possible. What is your expectation?
I want some medications to relieve this pain.
Definitely, I will try my best to help you, Mr. James. So, in summary, you are an accountant by profession and you are having high pressure and high cholesterol, and you are taking medication. Recently, you have started this Simvastatin 40 to 8 weeks ago, and you are having this problem of pain, weakness, and tenderness also in your thighs and cuff. And you think that it could be a bone problem or muscle problem. So you wanted to get some medication and to sort it out. Is that okay with you? You don't want to add
Yes.
anything?
No, doctor, that's all.
So, Mr. James, um, after talking to you and gathering the data, the most likely condition that I'm suspecting that you could have a condition called statin-induced myopathy. Are you familiar with it?
No, doctor.
It is actually a condition that affects when persons are taking a statin group of medications in a high dose, which has started, and it affects it causes some muscle damage, and it manifests as the tenderness and difficulty. In short, it is called myopathy. Okay. So
Okay, doctor.
we need to confirm it by doing some tests called CK and kidney function test, liver function test. Okay, and
Okay.
we will. I'm thinking of reducing the dose of that medication, but I would reconfirm it with consultation with the specialist cardiologist. How about it?
Okay, doctor.
And after, I will be meeting you as soon as possible after the blood test is over and my consultation is. In the meantime, I will consult the specialist and get back to you as soon as possible. In the meantime, I will give you some lifestyle advice like controlling your blood sugar, blood pressure, not to take excess salt, avoid smoking or quit it. That would be better. Reduce your alcohol intake in a social limit, and also take healthy foods, fresh fruit, vegetables, take regular low intensity exercise, avoid stress relaxation techniques. Okay. And if you feel any deterioration of your condition, that any dark urine or muscle pain is deteriorating with high grade fever, please come to us with immediate effect. I will provide the
Okay,
hospital
doctor.
contact number with you for that. Is that okay with you?
Okay, doctor.
And anything you want to add? Did I meet all the queries for today?
Yes, doctor. Which other medication will I be started on?
Simvastatin, we can replace it with rosuvastatin or pitavastatin, that is less, that is tendency to cause less effects. But the final decision I will take from the specialist. Don't worry. I will be informing you as early as possible.
Okay.
Any question
Okay,
you have?
doctor.
Thank you very much for your
No,
time.
doctor. Thank you, doctor. Okay. So this was your third case, right?
Yes.
Okay. Okay, so let's begin from the first case. First case was anorexia nervosa. Here, mostly patients will come either demanding new tablets, or maybe she is coming with the dizziness or feeling fatigue or weak. Then we have to dig more, like about what is she feeling, since how long, any weight loss. As soon as we come on the red flag weight loss, she will tell you a lot of weight I lost, and also the dietary habits. Where there is a weight loss and young patient and BMI is given mostly outside the station, BMI 16, then make your diagnosis right away. Okay?
Yes.
Every less BMI and young patient, most probably it is anorexia nervosa or any psychological issue.
Yes.
Could be any other, depending on the presenting complaint, but if patient is telling you I'm feeling dizzy and I'm feeling fatigue all the time, then you can proceed with this. One important thing was here to ask about the exercise. She was excessively doing exercise and thoughts of harming herself. These two things is mandatory in history taking for
Okay.
anorexia nervosa. Any
Thank
psychological disease, ask for any harm to themselves or to any other, any thoughts of harming yourself, no
you.
doctor. So they will continue like this. Examination, in this case, examination is must. Even though it's saying gray, you still have to do the examination. And
Okay.
labs at the moment, how we will do, because this is kind of emergency case, we are going to admit the patient, right? Here we
Yes.
are not letting the patient going home. We can just ask who came with you, and we are going to admit you at hospital. Why, doctor? Because the routine and the weight loss and the condition you are telling me, it might proceed to something serious, might be changing your heart rhythm, and it can be fatal. So that's why
Okay.
we have to monitor you by admitting you, and meanwhile, you will run the investigation at all the baselines, especially ECG, urea electrolytes.
Okay.
Okay,
Okay.
and you did the management nicely, like you first made the mind of the patient that you have to, but little bit, it was a dragged little bit. Try to like complete within 4 minutes or five max. But since
Okay.
it's a counseling case, it can go to 5 minutes of history taking and then 5 minutes of investigation, examination, and others.
Sure.
Okay.
Yes.
And here we are going to admit the patient, starting her on IV and drips, giving her proper calorie diet.
Yes.
Okay, measure caloric diet in the hospital.
Mhm.
So
Yeah. But we need to be careful about refeeding syndrome, hypophosphatemia.
yes,
Yeah, that I tried
this
to make it clear to her.
yes, but most probably when anorexia nervosa is there as a GP, we still have to admit for observation and continue
Yes.
treatment.
Yes. Yes.
Okay, we
I
are not
tried.
going to tell the patient each and everything thing like it can cause repeating syndrome. No, it's not needed for him.
Ah,
We will be taking care of it at
sure.
hospital,
Sure.
right?
Yes.
So
Yes.
next case was otitis media. Uh, you were ruling out red flags, you ruled out differentials, but the patient was, it's a small child. There is no need to ask for joint pain.
Okay.
Okay, there are
Mm.
few things that we can ask regarding the treatment. If we are asking a lot of things like each and everything of the red flags, then we won't be able to finish the case. So in this case, how we proceed? Few questions like since when it's going on? Does he have any fever? What about his mood, his sleep, and vomiting, diarrhea, and any skin rash? Okay, moreover, feeding. These 5 to 6 straightforward questions we can ask. And red flags are any autoria or any severe systemically unwell. If the child is playing, then it's okay. We can still put him on observation. But if she's telling you that he didn't move in bed since the morning, then yes, he is systematically unwell. We might start antibiotics. So you asked about the history well, but there was a little bit extra questions. You didn't leave anything, but there were questions that we can skip in this case. And
Okay.
mostly when we are talking about child, we won't ask any chronic illness or any long-standing illness. We will ask, is your child taking any regular medication for any disease? Okay, because long standing will be like high blood pressures and these things like that. Even asthma is not, uh, we call asthma as a reactive airway disease under
Mm.
5. So no
Okay.
chronic diseases there under 5. We will just ask, is your child taking any regular medication for anything?
Mm.
Okay.
Yes.
In
Yes.
this case, a child is more than 2 years old. He's systemically well, not very much unwell, a little bit of fever, and also no discharge. So we can tell the symptomatic treatment like pain management, more fluids, giving good diet, no frizzy drinks, or if the child is taking some junk food or fried food, we can ask them to stop, and we can give the delayed prescription
Okay.
for amoxil for 5 days if the symptom doesn't resolve within 48 to 72 hours. Or if there
Okay.
is any recurrent episodes, then you can straight away start the antibiotics. Okay.
Okay. Yes. Yes.
And the third case
Bahar ji
was
mai
statin.
antibiotic.
Third case was statin induced myopathy.
Yes.
Okay. Again, we can ask only few things like where do you have pain if they are telling you about legs. So
Mm.
we can just ask about 2 to 3 red flags like numbness of the sitting area, any urine or bowel problems, or where does the pain goes. If it's going all in the whole leg, then we can consider sciatica also. But we won't here consider about
I don't want anything sweet. Ice cream na
doctor,
kape
there's
to
someone's mic on.
No, you don't like ice cream. No, it's not that. It's just that. No, सुठो आहे हेल्थ लाइ पुटु खाइबो आहे पर ठीकु आहे तव्हांजी एज में बंदि बि कोन कबो आहे इट्स ओके
Dr. Zulfikar,
Yes.
थोड़ा थोड़ा खाए
just one
थोड़ा
point
थोड़ा खाए
I need to add.
मां घुराए त थोड़ा थोड़ा करे खाइजो I can't eat this. I took a sweet
Okay.
I'm not following you, doctor. Sorry.
Yeah, because your family is there and I cannot
No,
speak
no, no,
because
no.
of
It's
background noise.
yeah,
Yeah, it's okay.
actually not my side, maybe some other side.
Oh, okay. Just 1 minute, then I'll check. And in a statin induced, we just need to ask few things, not each and everything like temporal pain or anything else. 1 minute, I'll.
Yeah, better you can mute the others.
Yes, Dr. Khalud, I will be giving you cases. I didn't see you, I just saw you right now. Dr. Zulfikar, here, one important thing we are not going to ask about temporal arthritis or any vision changes. We can ask just about the medications and since
Mm,
how long he's taking, and one or two red flags as a sitting area numbness or pain going down the legs.
okay,
One important thing, you are going to change the medication of the patient. You are you can change this from simvastatin to rosuvastatin directly.
okay, okay.
Okay, we don't
Yes.
need a specialist input here, but even if you said it's a safe side, you didn't harm the patient.
Mm,
Okay.
yes.
And there is one important thing, sometimes patient will be bringing values. CK values could be normally or mildly raised, then it is yes, it's statin induced, but it is if it is more than 5 or 10 times uh, above the limit, then it is most likely rhabdomyolysis.
Yes.
And it will include dark urine and severe weakness. And there it needs urgent assessment and admission probably.
Yes.
Okay, these were all
Yes.
your
Yes.
cases.
Yes, ma'am.
Thank you,
Thank
doctor.
you. Thank you, doctor, for your invaluable suggestions. Thank you.
Thank you. Okay,
Doctor,
Dr. Khalud.
Yes,
I
doctor.
want to ask one thing.
Yes,
In
Dr. Azba.
this last case, the statin-induced myopathy, in which we changed medicine without doing test CK, we will change it. Yeah, first we will check the CK, then please
No, no, no.
explain.
Here we can check the CK.
Okay,
CK
may I miss
levels need to
that
be
part?
checked.
Okay, okay.
Yeah. I'm just saying that here we are encountered to change the medication. We don't need a specialist input. We either can lower their dose to see if it's coming into the normal range, like symptoms are getting resolved. But if it's twice above normal, then we are definitely changing or shifting to the other medication.
Okay, thank you.
Okay.
Doctor, can I
And
ask
if patient,
one question
yes,
regarding
doctor,
this? Sorry to ask actually. So if the
go ahead.
values are mildly raised, so in that case, and if patient is symptomatic, we can directly change to rosuvastatin.
Yes, sometimes patient is already coming with severe pain. Okay. And
Hmm.
the CK values are either normal or mildly raised,
Okay.
right? So
Yes.
in that case, it's your decision either to lower the dose, like this patient is already simvastatin 40, that's a lot for a patient. So you
Oh,
can either lower the dose and
oh,
follow up in a week,
oh,
but tell him that if your symptom doesn't get better or it gets worse, then come back suddenly,
okay.
as soon as possible. In that case, one more thing, if CK is double the normal value,
Okay.
then directly you will stop and monitor the symptoms or shift to the other statins.
Okay, doctor. Yes.
Okay, either thing are safe, it's not unsafe.
Sure. Thank you, doctor.
Thank you, doctor. So, Dr. Khalud, are you
Yeah.
available?
Yes, doctor.
Okay, so your patient is Mr. Rahman, 46-year-old male. Can we discuss her problem with you? Please proceed with history and management plan. Examination is great. Your time starts now.
Mr. Rahman,
Yeah,
6
Mr.
feet,
Rahman, 46.
46.
Yes,
Okay.
your time
Hello.
starts now.
Hello, Mr. Rahman. I am Dr. Khulud. How can I help you today?
Doctor, actually my big toe has become swollen.
Could you tell me more about your big toe problem?
Yes, doctor, it's going on for like an hour, a one day almost. It is
Mm,
getting hot and swollen, and now I'm
mm,
feeling it's getting red also.
mm-hmm. I am really sorry to hear about your pain. I will do my best effort to help you. Could I ask you some question?
Sure, doctor.
It's right or left big toe?
Right.
To start suddenly or gradually?
Suddenly, doctor, I got a
Uh,
severe pain.
yes. What does the pain look like?
Pain is very sharp and sometimes throbbing.
Mm-hmm. Okay. And what is the score of your pain? If 1 to 10, 1 is the minimum and 10 is the maximum.
Doctor, 7 to 8.
Okay, I see. And you said with this pain, you notice swelling, right?
Yes, doctor.
And the redness.
Yes.
Okay.
Yes.
Could I see your big toe?
Okay, just I'll stop the timer. Give me one
Oh,
minute.
okay.
Sending in group. Okay, doctor.
You sent
Yes.
uh, in the group WhatsApp?
Yeah, yeah. WhatsApp group.
Okay, just a second. I will check. Okay. And with this pain, do you have any fever?
No, doctor.
Any history of recent trauma
No, doctor.
or injury?
No, doctor.
Okay. Do you use any medicine or long term?
No, not longer than doctor. I just started this TB medication.
You start TB medications.
Yes.
Okay. You use your medicine regularly
Yes, doctor.
and you follow with your doctor.
Yes, doctor.
For how long you started it?
2 weeks ago.
Okay. Do you repeat the test for the cure?
No, doctor.
Okay. I will discuss with you about it. Okay. Do you have anything causing allergy, including the medicine?
No, doctor.
Do you have before any high blood pressure?
No, doctor.
Any high blood sugar?
No, doctor.
Do you have before any kidney stones?
No, doctor.
In your family, any member have the condition called gout?
Yes, doctor. My father had this problem.
And how he's doing now?
He is doing good on medication.
Okay, that's good. What are you doing for living, Mr. Rahman?
Doctor, I work as an IT specialist.
Okay. And with whom you live?
I live with my wife and one kid.
How things at home?
Everything is fine.
Okay, that's good. Do you smoke?
Yes, doctor.
How many cigarettes per day?
And these days I'm trying to lower like cigarettes, 3 to 4 cigarettes a day
Mm-hmm. For how long?
for 10 years now.
I appreciated that you tried to reduce your smoking, but Mr. Rahman, smoking has a lot of the hazard in your health, even if it's 3 or 4. How about to arrange session to talking about the hazard of the smoking and try to quit smoking? What do you think?
Yes, doctor, that will be good.
Okay, thank you. I appreciate it. Do you drink alcohol?
Yes, doctor, a lot.
How many units per day?
On one sitting, I take 1 or 2 glasses.
Daily?
Yes, doctor.
Okay, that's alcohol or beer?
Alcohol.
Okay. And what about your typical daily diet?
Doctor, I'm fond of meat and this red meat and seafood mostly.
Mm. Yes, I see. Do you do exercise?
No, doctor.
Do you have idea about your weight regarding to your height?
Doctor, it's I guess 28.
28. Okay, I see. Mr. Rahman, do you have any idea about your pain in your big toe?
Sorry,
Do you have any idea about the pain in big toe?
doctor, I'm feeling that this could be something similar like my dad.
We will discuss this point. Do you have any worries?
Yes, I'm worried about this. It will get worse and I will get another attack.
We will discuss this point. How can I help you today?
Doctor, I just want pain relief.
Oh, okay, we will discuss. Do you find any impact in your daily life related to your pain in your toe?
Yes, doctor, I couldn't go to my work today. I couldn't
Yes,
wear the shoe even.
yes, I see. It's a very difficult time for you. I will do my best effort to help you, Mr. Rahman. Don't worry. By the way, Mr. Rahman, do you have this pain before or is it the first time?
Doctor, this is first time.
Okay. Let me to recap. You come today because 2 days ago you started to have pain in your right big toe associated with redness and swelling. You are worried that that you have the gout as your father, and you worried that something serious or you have another attack. Anything else you want to add?
No, doctor.
Mr. Rahman, I want to check you. I want to check your temperature, okay, your blood pressure, your respiratory rate, and pulse. Is it okay for you?
Okay, doctor.
I want to have a look at your foot, okay? I move your big toe up and down, okay, and check for the
Okay.
pulse. Mr. Rahman, after talking and check you, most probably you have a condition called gout. I am clear so far.
Okay.
As you know
Yes,
that you
doctor.
said that your father has the same gout. The gout, it's inflammations happened in the joint due to accumulations of the material called urate crystals. There is a lot of the causes to this happened. Sometimes it's related to some medicine we take. Sometimes it's related to increase the secretions of this urate. Sometimes it's related to our kidney don't get rid of this urate. In your conditions, it's most probably related to your that's a new medicine you start for the TB and also related to your diet. I am clear so far.
Yes, doctor.
How about I want to do for you some blood test, full blood count, uric acid, CRP, a kidney function test, albumin create ratio, lipid profile, liver function test. Is it okay for you?
Okay, doctor.
How about to start for you for this pain medicine called colchicine, okay, 500 mg. You can use it twice.
Okay, doctor.
After 2 weeks, I wanted to see you to repeat again after 2 to 4 weeks, I will repeat again the uric acid level. Okay, because you are in the medicine for the TB and it's important to continue your course. After this attack, it's resolved, it's pain relieved, and there is no redness, no swallowing. How about to give you medicine called allopurinol?
Now, doctor.
No, after your this attack relieved, almost it will take 2 weeks. Now we will
Okay.
use the only colchicine, okay, to relieve the pain and the swelling. After 2 to 4 weeks,
Okay.
until this attack totally resolved, we will start this allopurinol. In this your case, because you are continue taking the TB medicine. I am clear so far?
Yes. Yes,
Okay.
doctor.
How about also to reduce your weight? Also, red meat, tea, coffee. This diet increase the uric acid levels at your blood. What do you think about it?
Yes, doctor. I'll try doing it.
Okay, thank you. I appreciate it. I wanted to, after the result are come back, I wanted to calculate for you cardiovascular risk assessment. It checks the risk to have cardiac disease in the next 10 years. Is it okay for you?
Okay, doctor.
I wanted to trim your nails, take care from the hygiene of your food, rest your food, apply ice pack over your big toe to relieve the pain and the swallowing. Is it okay for you?
Okay, doctor.
For your sake,
Okay, doctor.
you didn't go to the work today. How about to give you medical report for sick notes for 2 to 3 days until the pain it's getting better? Is it okay for you?
Yes, doctor.
You said that also you are worried about the recurrent attack. If we use this medicine and we follow the diet regarding to the meat, regarding to the reduce alcohol and reduce weight, and also after using this allopurinol, it will reduce the recurrent for that attack to happen again. I am clear so far.
Yes, doctor.
Do you have any concern, Mr. Rahman?
No, doctor. Time's up.
Okay. Okay, thank you.
Thank you, doctor. Okay, just 1 minute, bringing the next case for you. Okay, so your patient is Mrs. Lee, 26-year-old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is great.
26, doctor?
Okay. Yes, 26 years old.
Okay.
Mrs. Lee. The time
Okay.
starts now.
Hello, Mrs. Lee. I am Dr. Khulud. How can I help you today?
Doctor, actually, I'm 10 weeks pregnant and this is my first visit.
Mm. Could you tell me more?
Yes, doctor, this is my first child and it was planned and I'm really happy to it. But doctor, I don't know what to do. Like, is there any scan or results or lab
Mm.
tests I should do?
Mm-hmm. First of all, congratulations for your pregnancy, Mrs. Lee. I am here to answer all your concern. Don't worry. Could I ask you some question?
Sure, doctor.
You told that last week, last period, it's 10 weeks ago, right?
Yes, doctor.
Okay, you did the pregnancy test.
Yes, doctor.
It's at home or blood test?
At home.
Uh-huh, okay. And do you to make sure that your pregnancy is going well, do you notice, do you have any tummy pain?
No, doctor.
Any bleeding from down and below?
No, doctor.
Okay, do you use any medicine on longer term?
No, doctor. Only this folic acid I'm taking.
That's good. Do you have anything causing allergy, including the medicine?
No, doctor.
Do you have before any high blood pressure?
No, doctor.
Any high blood sugar?
No, doctor.
Any high fat in the blood?
No, doctor.
In your family, any member has any high blood pressure
No, doctor.
or high blood sugar?
Yes, my mother has high blood sugars.
And how she is doing now?
She's on medication.
Okay, that's good. Okay. What are you doing for living, Mrs. Lee?
Doctor, I'm a teacher.
Okay, and how things at work?
Everything is good.
Okay, with whom you live?
I live with my husband.
How things at home?
Everything is good.
Okay, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What about your typical daily diet?
I'm trying to have balanced diet like fruit, vegetable, juices.
That's good. I really appreciate it. Do you do exercise?
No, doctor.
Okay. What do you know about the pregnancy and because you told it's first pregnancy, do you have any idea?
No, doctor. It's completely new thing for me, so I don't know what to do.
Okay, we will discuss. And do you have any worries, Mrs. Lee?
Uh, yes, doctor. I don't want to harm my baby.
Okay, we will discuss this point. And how can I help you today rather than answering your concern and doing a scan for your baby? Anything else?
No, doctor. Only this that I just want a proper guideline.
Okay. Do you have any impact in your daily life related that you have a new that you have a new pregnancy?
Yes, doctor. I'm always thinking about like I should not do this or I should not eat this. So that's why
Mm.
I want to know clear plan.
Okay, that's good. I really appreciate that you come today. You discuss about your pregnancy. Let me to recap. You come today because you are pregnant. You are pregnant 10 weeks, and you have a concern about what you should to do when you should to doing a scan. For that, you come today. Anything else you want to add?
No, doctor, that's all.
I want to check for your pulse, your blood pressure, your respiratory rate. Okay, body mass index. Is it okay for you?
Okay, doctor.
Okay, Mrs. N, I want also to request for you a full blood count, hemoglobin A1C to check the level of your pregnancy, and also imaging for your tummy because now you are 10 weeks. Is it okay for you?
Okay, doctor.
Okay, and also because it's the first week, the first week, the first trimester, it should to continue on the folic acid as you did. I appreciated it. How about also to request for you screening for the hepatitis B, hepatitis C, okay?
Okay,
With a full
doctor.
count. Is it okay for you?
Okay, doctor.
Okay. About that's you asking about the scanning. There is a time of the scanning to check the viability of your baby and to check the sac. Is it okay?
Okay,
And
doctor.
related to you asking what you should to do, you should as you say as you did now, eating a healthy diet, avoid the eats the food that say has high vitamin A like carrot, like liver. This is the food it's better to avoid in the first 3 months. I am clear so
Okay,
far.
doctor.
Related to
Yes,
the
doctor.
exercise, you can do just light exercise, just light walking every 30 minutes for 3 to 4 days by week. Light exercise, it's okay during the pregnancy, no problem. Is it okay for you?
Okay,
Uh,
doctor.
Avoid to use any cream, anything that's including the chemical issue that maybe will affect you and your baby.
Okay, doctor.
Okay. That I want to see you after that the result, and I will refer you to the woman health doctor to monitoring you and to do the follow antenatal visit. I am clear so far.
Okay, doctor.
Do you need to ask me anything?
Doctor, when is my scan?
Your scan?
Yes.
Yes, your scan it should be doing now because you are 10 weeks now.
Okay.
After doing the blood test, we will request for you the scan. To check the sac of your baby, it's from 8 weeks to 10 weeks.
Okay, doctor.
And you can follow with the woman health doctor regularly for the others visit. And later there is some visit it will doing to check for the anemia also, but it's later. And also if from the 24 to 28 weeks there is a check for your blood sugars. And also from the 10 weeks to 12 weeks they will do for you for the any chromosomal abnormality to check for your check the neck of the thickness of your baby. I am clear so far.
Okay, doctor.
I wanted to see you when the result are come when the result are back. Okay. Please, if you notice any tummy pain, any bleeding from down below, seek the medical advice immediately.
Okay. So, doctor, which test did you tell me? Can you repeat for me?
We will do for you a full blood count, hemoglobin A1C. Okay. We will screening for hepatitis B, hepatitis C virus. Okay. And also sexual transmitted disease.
Okay, doctor.
Do
Okay,
you have?
still 1 minute remaining.
Okay.
Okay, so yeah,
Okay.
this was your second case. It was a twisted case. We will talk about it after your
Okay.
third case. Okay. Dr. Kulu, this is your first mock?
Yes.
Oh, why didn't you opt for the mocks previously?
I didn't register. I didn't see the when the doctor opens the time for the registration.
Oh, okay. So Your last patient is 1 minute. Okay, your patient is Mr. Khan, 62 years old, male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Hello, Mr. Khan. I am Dr. Khulud. How can I help you today?
Doctor, I'm getting breathless these days.
You have blood test?
And breathlessness.
Breathlessness. Could you tell me more?
Yes, doctor, and now I'm going up the stairs and I'm getting breathless. And doctor, actually, I used to walk like 300 meters, but now only on 100 meters I get breathless.
Okay. I am really sorry to hear about your breathlessness. I will do my best effort to help you. Don't worry. Could I ask you some question?
Sure, doctor.
Uh, when your this shortness of breath start?
Uh, Doctor, it started like 10 days ago mostly, but it was going on for a while, like 2 weeks.
Okay. But you meaning that it's getting worse by the time?
Yes, doctor.
Okay. That you said is that increasing with doing exercise, like as climbing the stairs and walking, right?
Yes.
Mm. Do you
Yes,
have it?
doctor.
Do you have it at rest?
No, doctor.
Okay. Do you notice anything relieve it?
No, doctor.
Okay. Do you walking at night searching for breathing?
No, doctor.
How many pillow you used for sleeping?
3 pillows now.
Okay, I see it's very difficult for you to taking a breath during sleep. Mm-hmm.
Yes,
I will
doctor.
do my best effort, Mr. Khan, don't worry. With this shortness of breath, do you have any cough?
Sometimes, doctor, but it's not a lot.
It's dry or wet?
Dry.
Do you notice it's increased at a specific time of the day?
No, no, doctor. Sometimes one or
Okay.
twice I get cough.
Okay. Do you have any chest pain?
No, doctor.
Okay. Do you notice any swelling in your leg?
Yes, doctor, I have swelling in my legs.
When it started?
It's same like 3 weeks ago.
Okay, I see. Do you are able to do the daily life activities? Are you able to dress and undress yourself?
Yes, doctor, I can.
That's good. Are you able to walking any do you notice any weakness?
No, doctor.
Okay. Do you use any medicine on long term, Mr. Khan?
Yes, doctor, I'm taking so many medications. I don't want to take it daily. Sometimes I skip it.
Why you don't want to take it?
Doctor, so many. I'll tell you, it's aspirin, it's ACE inhibitors, beta blockers, and statins.
For what you use this medicine?
Doctor, actually, I had this heart attack, 10 years ago. And since
Mm-hmm.
then, I'm taking so much. But now I don't want to.
Okay. And do you do any follow up with your doctor?
Since now 1 year, I didn't go.
Okay, I see. This medicine you used for the heart attack, do you have any high blood pressure?
Yes, doctor.
And any high blood sugar?
No, doctor.
Okay. In your family, any member has heart disease?
No, doctor. My
What are you?
dad had this heart problem, yes.
And how is doing now?
Doctor, he died of a heart attack at 58.
I am really sorry to hear about your loss. What are you doing for living, Mr. Khan?
Doctor, I stay at home. My son is taking care of me.
That's good. You live with your son, anyone other?
No, doctor.
Do you smoke
No, doctor.
or drink alcohol?
No, doctor.
Do you have idea about your weight regarding to your height?
Doctor, it's a 30, it's 28.
Okay, I see. Mr. Do you have any idea about your shortness of breath?
Doctor, I'm I feel like my heart is not beating properly.
Okay. And do you have any worries?
I'm scared of like dying dead like my dad.
We will discuss this, Mr. Khan. Let's to hope for the better. How can I help you today?
Doctor, I just want some medication.
Okay, we will discuss. How do you find any impact in your daily life related to your shortness of breath?
Doctor, I couldn't go with my friends outside, like we couldn't
Mm.
walk like I used to. That's why.
Yes, I understand. It's very difficult time for you. Mr. Khan, let me to recap. You come today because 10 days ago you started to have shortness of breath, getting worse with the walking, with the climbing the stairs. You are worried and you thinking that your heart is not working as before. Anything else you want to add?
No, doctor, that's all.
I wanted to check you, Mr. Khan. I want to check for your pulse, your blood pressure, your pulse, your respiratory rate, oxygen saturations, body mass index already given. I wanted to take look over your heart, inspection, palpation, auscultation, auscultate the lung from the back, and inspection for the lower limb swelling. Is it okay for you?
Okay, doctor.
Mr. Khan, how about to do? I want to do for you a test called beta nitric peptide.
Okay, doctor, it's a bibasal crackles and mild ankle edema.
Okay. I wanted to do for you beta nitric peptide. Okay, is it okay for you?
Yes, doctor, it's a 2000.
Okay. Mr. Khan, after talking you and examine you, most probably you have a condition called heart failure. Do you hear about it before?
No, doctor.
It's meaning that your heart is not working as before. That's not meaning at all. It's not working. It's just not working as before. I am clear so far.
Yes, doctor.
Most probably in your condition because you stop the medicine after this heart attack by yourself. How about to refer you urgent within 2 weeks for the heart doctor to do for you imaging for your heart called echocardiograph. I am clear so far.
Okay, doctor.
Okay,
Yes, doctor.
how about to start with you now by furosemide 20 mg, okay, to reduce this swelling in your leg. Is it okay for you?
Okay, doctor.
Okay, Mr. Khan, how about to start to take your medicine regularly until you see your doctors? Sometimes some medicine we should to continue it for lifelong. Some medicine maybe the doctor will stop for you later. I am clear so far.
Yes, doctor.
Okay, I want to see you after coming back from the specialist. Please, if you notice this shortness of breath at rest, if you notice any chest pain, if you notice your symptoms getting worse, if you have any concern, don't hesitate to come to me.
Okay, doctor.
Do you want to ask about, do you have any concern, Mr. Khan?
No, doctor, that's all.
Okay, thank you.
Thank you, doctor.
Still
Still
time?
1 minute remaining.
Okay, we can talking about
Yeah.
the diet because we didn't talk about the diet.
Okay, doctor.
Okay, what about your typical diet, Mr. Khan?
And doctor, I'm taking this junk food mostly in salt dish.
How about to I see also your body mass index it's high. How about to start to reduce your weight and also to reduce the salt in your diet, avoid the fast fat meals. It will improve your conditions. And by the way, if you I wanted to check your weight. If you notice that's increasing 2 kg in or rapid increasing in your weight, seek the medical advice immediately. I
Okay,
am clear
doctor.
so far.
Yes, doctor.
Okay, started to eat balanced diet, started to eat just exercise until you feel tired, take rest, and after that you can continue. Is it okay for you?
Okay, doctor.
Okay, thank you, Mr. Khan.
Thank you, doctor. Okay. So, Dr. Khalud, very nicely done. And it was your first encounter with me. So, you are, mashallah, well prepared for the exam. Let's go from case to case. In the gout, it was very precise history. And you asked about CVD risk for the 10 years. It was important point in here. And also you did did you refer him for after 2 weeks for the assessment after 2 weeks of TB medication to do his testing again, PCR?
I informed in the history, but when I come to the management, I forgot.
Yeah, you forgot, but it's okay. You knew in the history. That was fine.
Mm.
So I don't have to add a lot in your first case. Second case was
Antenatal, right?
whenever yeah, antenatal ANC care, but here the hidden thing was on the investigations. Okay, you didn't do urine culture. She was asymptomatic E. coli positive.
Yes, right, yes. In the first, we should to do urine analysis, yes.
Yes.
Mm-hmm.
Yeah, urine analysis, and here we will be starting
Yes,
pregnancy
even if
screening drugs.
asymptomatic. Yes, right.
Yes, and also there are few things we have to tell the patient, like avoid cheese and carrots, as you told, and canned food, also the poor cooked
Processed
meat.
food. Yes.
Yeah, and HbA1c you did in the first visit where it's not needed until and unless the patient is here we will do OGTT only for the patient who has who had previous GDM or is having the diabetes. Okay, then
Yeah, no, I
OGTT
didn't request.
is done.
I ask here. We will do at 24 to 28 week.
Okay, but still HbA1c will not be done in the first
No,
visit.
I don't think do
OGTT will.
hemoglobin A1C. I don't. I wanted to request beta HCG.
Okay, all
Yes,
right. That's
I
why
said it
I
by
asked you
mistake.
twice.
Yes,
Like,
no, I know that for the pregnancy we didn't request hemoglobin A1C.
yeah,
Yes. No,
because its
yeah,
values are
yes.
not up to the mark. It can be false positive or negative.
Yes, I know for the
Okay.
baby and for the pregnant, no hemoglobin A1C. I
Yeah.
meaning HCG, beta HCG.
Okay. Okay. Otherwise, your case was very nice. And the blood group also.
Yes.
This is positive or negative. We need to say it. Booking a scan will be done. Another scan for NTDs. We can say the other scan because the recent scan should be told. The booking scan will be done right now, and another from 11 to 14 weeks. We will be
14 week
also
for the anomaly.
yeah for the anomalies. No,
Yes.
for the NTDs. It's another
Okay.
I don't know what it's
Okay.
called. I forgot actually.
Mm.
So in the third case, because anomaly scan is 16 to 20 weeks, and this first booking visit scan is also from 11 to 14, where neural tube and downs are screened.
Okay.
Okay, and last was what was the last case? Sorry.
Heart failure.
Yeah, post MI heart failure. Here we will tell the patient about it's post MI heart failure, not just the heart failure. It is caused because of your previous heart attack and you're not taking your medications all time. So, and one important thing, what did happen in the hospital? It was 10 years ago, so it's not very necessary. But sometimes if
Long
patient is
time.
coming after 2 weeks, yeah, then we have to ask what happened to the um, like recent MI, you have to explain each and every detail of the
Yes.
medication and
Mm,
also
mm,
driving if he wants
mm.
any medication like and also flying and sex. Also, we have to address all of it.
Yes, and the depression.
And
Here I
wait,
forgot to ask about depression.
yeah, post MI. You didn't ask for screening tools for post this depression, low mood, and loss of interest.
Yes,
In
yes.
every chronic case, we are going to ask these two
About
things.
depression. Yes, right.
Yeah. Weight you told, and in the last 1 minute you told about keep checking the weights every weight. If it's more than 2 kg in 3 days, then it's necessary for you to come back. Otherwise, all the cases were very nice. Okay.
Okay, thank you. Thank you.
Yes. Tough luck for everyone for the exam. Tomorrow is the last day for the first phase, and I hope it was all good for you. These sessions, even listening to it was um, informative. Okay.
Doctor, thank you so much, Dr.
Thank
Musara.
you, doctor. Thank you so much.
Thank you, everyone. Thank you, everyone. If any question and queries, please put in the group. Thank you, everyone.
Thank you.